Well, November is National Hospice and Palliative Care Month, and while the topic can be hard to discuss or think about, it is good to have some knowledge if the situation arises that it's needed. So Jancy Richardson of Deaconess is here to talk about with us this morning a little bit about it. So good morning.
Good morning.
Thank you so much for joining us.
Thank you for having me.
So let's talk about hospice care. It's National Hospice Care and Palliative Month.
Yep.
What's the importance of having hospice care?
So obviously the importance of palliative care and hospice is we all get to a certain point in our lives where we're faced with chronic illnesses and challenges, and it's important to be able to have that support in our community to make sure that people feel comfortable and that they have all of their questions answered as far as end-of-life care concerns, and we're just here to support.
And is hospice care in-house, or is it a location? Because I know you all have the Linda E. White Hospice Care House there.
Yes, so hospice is offered at multiple different locations. Of course, anywhere where someone calls home is considered hospice. So you can do it in an independent living facility. It's provided at home. It can also be provided in a skilled nursing facility or a nursing home. And then, of course, it's provided at the Linda E. White Hospice House for inpatient hospice care.
So when should someone start to consider hospice or palliative care?
So palliative care can be considered at any time during a person's chronic illness. So that is typically focused on, they're still curing treatment or looking at curative treatment, but of course doing symptom management. And then for hospice services, typically we are looking for people and patients that are within that one year life expectancy, and then they typically qualify within that last 6 months of life. But it's always better to start having those conversations sooner rather than later, so that you know and you're able to make that educated decision whenever you're ready for hospice services.
So let's talk about more specifically hospice, because a lot of people, I guess there's a myth out there, and I was one of them. When you hear someone's going to hospice, you think, oh gosh, they only have a few days to live. But
yes,
that's not true. I know someone in hospice care has been there for over a year now.
Oh, absolutely. So people can benefit from hospice services for so long if they are wanting and willing to come on hospice services sooner rather than later. So sometimes people can even graduate from hospice. So they can come on service, do really well, and then even progress off and then come back on service in the future whenever they need that support again.
Wow. Now, if you have to move forward with this, or someone in your family does, how do you begin the process? And there's so many questions of like, yes, does insurance pay? Does Medicaid? How's all that work? So
the best thing to do is just to call, and we can do an informational visit. And that can either be by phone or it can be in person. Best case scenario is it's in person, because we get to be in that living situation and we get to see what you're struggling with, how your house is set up. We can talk about all those little bitty nitty-gritty details, and we can answer all of those questions in person. And then, of course, during that visit, you don't have to make a decision if you're ready or not. It's important to start having the conversation, and then, of course, down the road, then you know whenever you're ready. You know,
Ron made a comment a moment ago. He said that when he had to use it with his mother, hospice was a godsend.
Oh, absolutely.
How is it different than just going to the doctor and getting a checkup?
So this care is provided in the home, wherever you call home. So if your loved one is in a skilled nursing facility, they still receive that around-the-clock care by the facility, but our hospice staff come in, nurses, home care aides, our bereavement coordinators help the family afterwards. I mean, there's a whole group of individuals that come in and help be an additional layer of support.
It's really just kind of a phone call away, like 24/7 care?
Absolutely. So if you need something in the middle of the night, our nurses are on call 24 hours a day. So you call us. The goal is to, of course, keep you from going back into the hospital, because that's not really where you want to be at that point. You want to be at home. You want to be with your family. You want to be where you're comfortable. So if you need something, I always tell patients, I don't care if it's 2 o'clock in the morning, you call us so that we can help you.
It's all about care and comfort for the patient, but also the family too, to give a little bit of stress relief for the moment for them. So.
Oh, absolutely. So whenever I have these conversations, the patients are the center of everything that we do. But the ones that take care of the patient, their family, their loved ones, they are the ones that we're there to help support as well. It's so important to have that.
Well, thanks so much for taking care of families across the tri-state. Appreciate you, Jancy.
Thank you.